We are talking about the biggest health problem in the world. It's a long story, but I try to make it brief. So I was visiting scholar at Harvard University in 2011 doing quantum physics. And I met a colleague who was also doing quantum physics, but also as a side project, he was studying musical rhythms. And I got very interested as a hobbyist drummer. And then I suggested that we should work together on this and analyze musical rhythms. And that's how we started working together. And we found some nice ways to analyze micro-timing deviations of drummers. And then, fast forward 1 year, I met a cardiologist who was studying heart cells. And I saw a video of beating heart cells, individual cells, and got very interested and suggested that why don't we study the beating patterns, like drumming of those heart cells. And we started working together, and we got some funding for our research. We published a lot of papers, and this is where we are. So we really started from physics with different methods that we had developed, and then we started applying those methods to a completely new problem. So I'm Esa Räsänen. I'm a physics professor at Tampere University and also the CEO of Monicardi. The simplest way to describe what we are able to do, we are able to predict some major cardiac risks and diseases, for example, congestive heart failure. We are able to assess the overall cardiac risk as well. The innovation is in the software that we produce for wearables to monitor cardiac conditions through ECG analysis or beat-to-beat analysis of the heart rate. And here we have really developed something innovative in the past, let's say 10 years. We are talking about the biggest health problem in the world. So cardiovascular disease is the #1 killer in the world. It's about 32% of all the deaths are due to heart problems. Of course, there are many ways to tackle this problem, and what we are trying to achieve is really making cardiovascular health monitoring common among all the people, so that common people with any wearable device is able to monitor the state of the heart and then take action when needed. We applied to ESA BIC Finland because we felt like, this is interestingly close to what we are doing, like really minimizing the power consumption, generating effective algorithms that could be also tested in space, and also they could be used by astronauts to analyze biosignals. So we found this connection, and then we worked this case further and we applied, and then we eventually got funding, and we are very grateful and eager to be part of this.